disposable syringe that guarantees the gold standard of catheter maintenance, saving hospitals money and saving patient lives. Central venous catheters are a staple of inpatient treatment, allowing medication to be delivered straight to the patient's bloodstream. These catheters can stay inside the patient for years at a time and give nurses easy access for blood draws and medication infusions. Central venous catheters are prone to thrombotic occlusion, or the formation of a blood clot inside the tip of the catheter. Out of the 10 million central venous catheters that are implanted each year, 15% of these become occluded. These clots increase the risk for central line-associated bloodstream infections, or CLABSI, which are associated with a 25% mortality rate, and require the use of expensive and time-consuming declotting procedures. Large hospitals in the US are spending $3.5 million yearly on managing occlusions. The gold standard for minimizing these occlusions is a technique outlined by the Journal of Infusion Nursing known as Pulsatile flushing, whereby lines are flushed with saline using a start-stop method in which the syringe is emptied in increments. Studies have demonstrated that pulsatile flushing most effectively clears the catheter of substances that adhere to the lumen when the syringe is emptied 1 milliliter at a time, pushing for half a second and pausing for 4/10 of a second. However, nurse compliance with pulsatile flushing is as low as 6%, as it is more challenging and time-consuming than pushing the syringe in one motion. Hospitals and nurse managers are looking for ways to address these staggeringly low compliance rates in the pursuit of improving clinical outcomes for patients and reducing the associated cost burden. This is why we developed PulseFlush, a disposable syringe that integrates into the nurse's current workflow and allows them to perform pulsatile flushing without actively having to push and pause. Our proprietary design de-skills the task of creating the optimal push-pause profile. Adherence to this technique has been associated with decreasing occurrence of occlusions by over 50%. With PulseFlush, we can prevent delays in treatment and reduce costs associated with occlusion treatment. PulseFlush can act as a direct replacement for every flushing syringe that is currently used. The current global pre-filled flush syringe market is $400 million, which is our total addressable market. Our serviceable addressable market in the US is $200 million. We will initially focus our efforts on large hospitals in the Northeast, which gives us a serviceable obtainable market of $50 million. PulseFlush is the only product in this market that standardizes the optimal pulsatile flushing profile. While hospitals have attempted to enforce this protocol with nurse training, compliance still remains low as the direct benefits of improper flushing are not immediately tangible. By providing a tool to de-skill and standardize pulsatile flushing, PulseFlush will save hospitals money and ultimately save lives.